welcome back to episode 2 of What's Next, Survivorship Edition. I'm Dr. Dave Bullis, I'm your host. So episode 2 is really looking at sort of a template for what a survivorship care plan would be like. And I think the first thing is just an example, it's an important record of what you've been through so far, and partly that's just to help you give yourself credit for all the things that you've had to overcome. And the other purpose, though, is that there are other people in your life, your physicians, your primary care doctors, your other specialists, who would benefit from knowing some of the details of what you've been through and what your longer term needs are going to be. And so we also want to cover what needs to be on it. And so let's just take that one thing at a time. So what have you been through so far? As you may have seen in the introduction episode, you may have been through surgery. There's medical, radiation oncology, there are medications, maybe palliation and symptom management. There are other treatments that are coming online now that are new, like stem cell, immunotherapies, and other trials. So every single patient who goes through any kind of oncology treatment has a very unique and sort of separate kind of treatment plan. And as a result of that, we want to make sure that we're capturing it. There's not some sort of one off-the-shelf kind of treatment plan that fits for everybody. So this is just a very generic kind of template. And I call it the Survivorship Treatment Tracker Decision Sheet, which is a lot more words than probably I'm needed. But at the very top of the form is the goals of care. And then as you go down, you can see that there are a variety of different the treatments, the surgery, the chemotherapy, radiation, medications, palliation, and other treatments. And we really want to look at when the treatment happened, what the treatment was, any complications or concerns that may have come up, and then what the follow-ups are going to be. So let's just go through it one step at a time. So the goals of care. This is the first thing, and I think it's really important for you as the patient to be able to put right up front what it is that you wanted from this cancer treatment, and that's what we can do to sort of help keep us accountable and also help keep your eye on the prize, as it were. So for an example, for this patient, the goals of care included the basic construct of maximizing mobility, being able to move around and be active, the capacity to spend time with friends and family. Would like to be able to travel, but more important that I feel like I'm acting, thinking, and feeling like myself. I think this is an example of the goals of care aren't specific to a medicine, right? Or the obvious treatment plan like I want to get rid of cancer. That's sort of a given. But basically, we want to make sure that you're able to put into words what it is that you wanted, and then we're going to make sure that we try to attune to that. Again, this patient went on to say that they didn't want to be a vegetable or a burden to anyone else, and they wanted to minimize some of the symptoms like nausea and pain. That was the initial goals. Obviously, goals of care conversations we encourage people to have with their medical providers at the very beginning of treatment as well. But this is really just sort of reaffirming what some of those goals were so that we can sort of keep track. And what we want to make sure is that every treatment that you had going through this, and likewise every treatment that you're going to be continuing to have into survivorship and for the rest of your life, really is aimed at helping you meet those goals of care. That's sort of the whole. That's the sales pitch. That's the bottom line. So your surgeon, Dr. Sir Gion, is from Mass General, and you had your surgery. This person had their surgery, on February 2nd, and this is a breast cancer patient. So the treatment very specifically was a right breast excision of a grade 2 tumor. They had a sentinel node lymph node dissection. The tumor measured 19 millimeters. LVI was negative, ER positive, PR negative, HER2 negative, and etc. So this is a very specific set of treatments. It was a very specific result. It's really helpful for primary care and other specialists to know exactly what the treatment was. Going across to complications and concerns, there was a clean excision with no residual disease, but there was some concern about the shape of the breast and the residual scar, and there had been some times when it was painful and it felt weird, quote unquote. And I think those are things that are important for the providers to notice and to recognize that that's what they really want to be following up on. There's no surgical, there will be surgical follow-ups, as you can see in the follow-up visits, which are typically monthly for 2 or 3 months, and then more sporadic 6 to 12 months after that. But the idea is that you're really trying to draw the attention of the other providers to what the ongoing concerns will be. And I would just say, as a brief disclaimer, this is not meant to be what an actual care plan would look like, although I think these are some of the concepts that you want to make sure are included in the one that you're going to have with your provider. So that's the surgery part of it. If we then think about what chemotherapy you had, you were treated by Dr. Onko here at Newton-Wellesley. And the dates of treatment there were 2 courses from December through January, and then again later in February to April. And you can see in the treatment, it was started off with carboplatin, and then after treatment, there was Arimidex that has been an ongoing treatment. The complications concerns that were needed to be followed up on were nausea and fatigue, were a big issue during treatment, and they were also noted to have continued even after treatment was over. And these are some of the symptoms that can persist for weeks or months. So when we talk more about coping with the physical, we'll get more into that. But just it's an example of that's something that you want to be drawing the attention of your provider to. Again, follow-ups will be every 2 weeks, it started in April, and then it was every month starting in July, and then it went to every 6 months starting in December, and then yearly going forward in December of 2020. So this is the idea of just sort of mapping out sort of what the follow-ups are going to be, something to help you kind of prepare and think about scheduling with other parts of your life. So next, moving on to radiation therapy with Dr. Radiation. That course of treatment was from January of 2018 to February of 2018, and it lists the kind of the full dose and how many different sessions you had to have. And there were weekly follow-ups with the doctor at that time. Some of the concerns included drying of the skin and feeling sunburned. There was some concern about how long that would heal, and then what were some of the other sort of short-term fixes like lotions and soft clothing, and then that was something that you wanted to kind of keep track of, or this patient wanted to keep track of over time. Again, follow-ups were periodic and then spread it out over time. Again, starting with yearly follow-ups starting in a couple of years from now. Medications included, again, this was under the purview of Dr. Onko, the chemotherapy oncologist. That started in May of 2018, and it lists out what the medication was and how much was needed and how long that would be taken for 5 years. Again, concerns were fatigue, mental fogginess. Also, dry mouth was sometimes reported as a concern, so that's something that you want to follow up. The patient here wanted to follow up with their physician about. Again, follow-ups are then charted on a regular basis, and you can see they track with the other follow-ups that you're already having around the chemotherapy. So that's something that you can sort of begin to plan out. Palliative care with Dr. Les Payne, an excellent physician here, made up, of course, at Newton-Wellesley. This is really about symptom management, about some of the pain and discomfort, and that was active treatment from December through May again. And this was, there was monthly follow-up while there was an active treatment. There was prescription of medication for the pain, and also another medication, Remeron, for sleep and mood, which was also an important part of that active treatment. Of course, some of the complications with having pain medicine, of course, are drowsiness and sedation, some ongoing pain from other sources that weren't being addressed by the nerve pain agent of Lyrica. And so those were needs that needed to be followed up and sort of more actively managed by the medical team in concert with the palliative care doctor and the primary oncologist. So follow-up with palliative care is really only going to be on an as-needed basis. There are some goals of care conversation or other pain and management issues that maybe were important. And so that's more of an as-needed thing, and this patient certainly knew of that and felt like that would be something that they could take advantage of. And then finally, down here at the bottom, which is a little hard to see, but there were no other research trials or targeted therapies that were needed. Basically, the concept here, though, is because there's uncertainty about it, it's a topic that you kind of this patient wanted to keep front of mind. And so the follow-ups were just recognizing that Dr. Onko was going to discuss any new breaking science that was going to be important for this patient while she was going through her treatment. So as you can see, this is sort of the sum total of what a full survivorship care plan would look like. This, again, is not meant, the survivorship care plans that you do with your treatment team may look different than this, but these concepts of the name of the provider, when you had the treatment, what the treatment was in specific terms, and then any complications and follow-ups are what allows you then to summarize all your treatment in sort of one place. And then you can share this document with any other provider, and they can then have a much better sense of what you've been through and then also what your ongoing concerns are. So that's we want to encourage people to ask for that and really help their physician and providers know what they're looking for. So this survivorship plan, I think the most important thing is it's yours. It's your information. You get to take it with you wherever you feel like you need it. If you don't feel like there's a provider that needs to know about it, then that's fine. But it's a way of summarizing all that you've been through in as concise a way as possible. Obviously, it doesn't go through all the details of what it was like to go through treatment. No document could really do that other than the full medical record. But this is a really kind of a nice summary. It is true that the reason why this is important is that the more your medical team knows, and I mean your medical team thought broadly, which is every provider you have, the better they can help you manage the symptoms, and they can be more proactive in thinking about what some of the challenges may be. And it's also, I think, from a psychological perspective, helps to just take stock of all that you've already overcome and all that you've successfully gotten through as a way to give yourself credit that this is not necessarily a walk in the park. And we want to make sure that you know that and can take full credit for all that you've already been through. So thank you that's the end of episode 2, and please stay tuned for more episodes.